So I want to thank everyone to come here today. I know some of you guys at home and probably didn't have work to do, but I really appreciate you just being here. Every one of you guys are going to be a collaborator of this project, so it's very critical and important for me and the rest of the group that every one of you here and understand what we're trying to do, because you can be a leader outside and teach other nurses and other health professionals to basically push this idea through. Now, an illness is a subjective reaction of a patient to the disease. And it's not just the signs and symptoms, it's also associated with the changes in the behaviors and also relationship. It's a multifaceted problem. It includes their psychosocial changes, the economical changes that happen when they develop this kind of disease. So as a physician and health professional, it's very important to see the patient's problems as an illness, not taking care of those signs and symptoms. In fact, medicine, when it starts, it was not considered as a scientific field. It was an art that was just not about giving patients medication and performing operation. It was involved all of the aspects and processes of life to be able to guide the patients towards improvements and well-being. So at some point in our history of mankind, there was a time that physicians were called God and nurses were called angels. It was an incredible divine and angelic relationship between patients and health professionals. But unfortunately, over the last few decades, there's significant mistrust between us and them, and separated us from them. And why is that? There was a lot of other issues that happened throughout these few decades. Obviously, medicine is also a business. So there's a lot of other players involved, physicians and administration, the pharmaceutical companies, the insurance companies, and even government, right? It created a significantly complex system, healthcare system, with a lot of laws, regulations, and policies and procedures. And then over the last 5 years, we also have got introduced to Affordable Care Act. And it came out with a lot of other new terms and laws and regulations, like some of them are you used to, and some of them is very difficult to remember or define. But it was meaningful use, accountable care organization, health insurance exchange, changing in the reimbursement, a lot of changes that happens in our medicine and healthcare. Age caps and patient surveys and satisfaction, core measures, value-based purchasing, EMR, and the one that you are very familiar with, the EPIC. So that it created a more complex or perplexed system. So a lot of those things actually are good. A lot of those laws and regulations are good for our patient care. We try to protect our patients and give them more access to the healthcare. But at the same time, that complexity creates problems and consequences. And those consequences we need to know, because we are in front line with patients. And those consequences are the ones that we have to understand and try to alleviate. One of the consequences is the chaos and problems with the relationships between the people that are involved in the front. The medicine over the last 15 years that I've been practicing has changed significantly. Even my colleagues in the hospital. I can see the way that they practice and take care of the patients is so mechanical. It's supposed to be an evidence-based medicine, but it's like an algorithm-based patient care with very little essence of humanity. And the nursing job is not a profession, it's a job of a task. It's a task-oriented job with giving patients medication and writing notes and reviewing the books and computer writing. And it doesn't look like this when you come to the hospital, but it feels like this when you come to the hospital. And that was my personal experience last year with my son going to 4 hospitals and having different surgeries with different surgeons and seeing different healthcare professionals in different hospitals. I felt like in factory line. I didn't appreciate the way that I was treated or my son was treated. It created a lot of angry and upset, frustrated, tired physicians, and also burnout, exhausted nurses, right? And at the end, very unsatisfied patients. But one of the most important things, in my opinion, that happened is the separation of patients from us, losing that angelic relationship that we had with the patients is completely lost in this complex system. And the attitude of our care right now is the attitude of indifference. Nobody cares. Because we are so involved with the tasks in our hand that we lost the real value why we're here and why we take care of the patients. So PHPEP is about creating a new culture, is about bringing that angelic relationship and restoring that relationship, is about promoting compassion, connection, care and kindness, creating an authentic connection and trust with the patient, and also sharing those positive human experiences in healthcare. And it came from a belief of mine, because I have the opportunity to be a physician and surgeon for the last 15 years, and also a patient and family over the last 2 years. And I came to this belief that in order for you to have that opportunity, you need to get to focus on the well-being of the health professional and patient experience. And these two absolutely related and linked to each other. You cannot have and create a patient experience in the hospital without looking into and creating an environment for well-being of health professionals. And if you do not create that the patient experience, you will not have that well-being of health professionals. These are all connected together and linked. It's very hard to tell a nurse that is fully involved and exhausted with all of these tasks without any meaning, to create a patient experience, to be kind and compassionate. And it's very, very hard for you to feel good about what you do if you do not create that experience for the patient. If you sit at home and say, I'm a good person and trying to do a lot of emails and work on the computer, and you're the best in putting the stuff in the computer, you're not going to have that satisfaction and content if you don't create that patient experience. And the bottom line of the PHPEP is to create eventually a culture that patient experience and well-being of health professional is the mission. What does the experience mean? The experience is what we perceive, understand, and memorize from an event, right? And the event can happen to us, our family member, or around us, our surroundings. And these experiences sometimes, not all the time, sometimes comes with an emotion in our mind, in our heart. It associates with that emotion. And those emotions can be negative emotions and positive emotions, right? And the negative emotions are like fear, anger, frustration, shame, and guilt. And these negative emotions for humanity is very important because they actually help us to survive. If you don't understand the fear of a snake or an angry dog, obviously you can get injured, right? So negative emotions are sometimes important for us to help us to survive. But there are also positive emotions. Positive human emotions are joy, pride, the gratitude. And these emotions are not lifesavers. They're tiny little rewards in our mind and our heart. These are the rewards that help us, to motivate us to do things, to be a good person, good human being, to motivate us to do something in our life, right? And it's very, very established scientific thing. These are not voodoo things that somebody says 3,000 years ago. These are all scientifically proven. These are the tiny little rewards that help us in our mind to do the right thing, to be a good human being. And what is it to do with our well-being in our profession? Okay, positive feeling and positive values are incredibly important for our well-being. They make us feel content and motivated and inspired to do the right thing. It makes us to be resilient, to tolerate the tasks, the difficult tasks, right? Of course, they're short and momentarily. They're instant. They come and go. They're emotions, right? But at the same time, when they accumulate, all these daily positive emotions, when they accumulate, it changes the structure of your brain. And it changes the way you deal with others. It changes your character. It makes you towards being a better human being. It brings a better version of you. And I noticed that in myself too. Last week I was talking to my boss. I said, "Looks like you're a different person. Not that angry, upset, exhausted surgeon." So PHPEP is based on 4 essence of humanity. It's about compassion, care, connection, and kindness. Those are the ones that we have to practice in order to get to those positive emotions. Compassion is perspective taking, is putting yourself in the patient's shoes, understanding their pain and suffering, and wanting to actively do something about it, taking care of them, putting yourself in their shoes. Compassion is everything, is a foundation of our survival over hundreds of years, thousands of years. It's acknowledgement of us being vulnerable, afraid. So you understand that you need others to be able to survive. That helps us to be 7 billion people right now in the planet. And care, in my opinion, is opposite of indifference. Opposite of indifference. I remember my mom was always telling me when I was a child that if you're angry of somebody, you don't like that person, don't try to fight with them. Just try to ignore them and be indifferent. That's the worst thing you can do. In our healthcare, the attitude of indifference is the worst thing that we can do to our patients. And care is everything in our profession. Even care means being sensitive to every little thing that happens around us, to our patients. Not ignoring their needs. Even if we're tired, even if we overloaded with all the tasks. When you care, then you decrease the mistakes. You don't need protocols, policies, procedures. It's come from our heart. It's like you taking care of your mother, your family, your child. You care the same way you care your family, and you care the same way you want to be cared. And all of these has to happen with kindness. Without the kindness to your patient, none of those matter. Compassion and care means nothing to people when you do it with attitude. It has to be the attitude of kindness. Then everything comes together. It's like a little flower. Now, in order to be able to come to this playground of healthcare and try to stimulate those positive emotions and practice compassion and care and kindness, you need to create trust and connect with your patient. Those are two incredible and important elements. If they don't trust you, they don't believe you. And you need to be a master of connection. And you have to practice that. Some people better than others, but you can be good at it. And we talked about connection in the past. Connection means being there, being present, being at that moment with the patient from the bottom of your heart. And when you have all of those, the magical moment happens. It's a magical moment that you create an incredible experience, and that positive emotion of gratitude in your patient. And when you have that connection, that magical connection, that energy transfers to your brain and your mind. And you feel the same way they feel. You feel the gratitude, you feel the content and joy of taking care of that patient. When you look at them, when you see their face, when you see their smile, their gratitude, they don't need to say anything to you. You just see them from their face, their gesture. And what happens is actually it enhances these shared emotions, enhances that emotion, and it stays within you. And that's the one that changed the culture. If every one of us do that, it changed our culture. So when people come into this hospital, they say it was something different. They might not be able to explain it. Over the last few months, I brought a few of my patients from down south, Orange County, to this hospital. And you know why I didn't bring him because this hospital is the most beautiful hospital. I didn't bring him here because they had the best equipment. I brought him because I saw the humanity in every one of the nurses that they helped my patients. And you know what I got? Yesterday I was in my office and I saw one of my patients. You know what he said to me? The first thing he said, I can't believe how beautiful that care was. He wasn't talking about me. He was talking about the nurses that will take care of it. And I invited the administration here to see what we're trying to do is actually has positive values for our hospital as well. There are some byproducts of that. Okay, the byproducts of that is that when people feel the same way to their patients, they feel the same way to their families and their friends and colleagues. You improve your teamwork. When you care, you decrease the errors and you decrease the cost, and you also improve the quality of care, and you improve your health. No question that our mind and our body are connected. This is not 30 years ago when there was no scientific proof. Right now there are scientific proof. But what we do and how we feel, our emotions are important, our genes, even changing our genes, helping our immune system to protect us about diseases, illnesses, and even our relationship are so important to activate those factors. And the most important thing for the administration is it creates a blueprint for other hospitals and improve our market share. So it has a lot of byproducts for us. So PHPEP is an invitation to a playground of medical care for you to create a safety zone of trust and create an angelic and divine connection with your patient, to practice the essence of humanity, of compassion, connection, and care. That's why it's incredibly important to create experience. Thank you.